I am Dr. Deepa Dewan. I am a Senior Director at Cloud9 Hospital, Golf Course Road, Gurgaon. Minimal invasive surgery is definitely a better option for treatment of endometriosis as compared to a traditional surgical method of laparotomy. These days, that's the method which is used by most doctors. Why so? Why minimal invasive and what exactly it is? Minimal invasive surgery is also called a keyhole surgery. So what is done in this is small punctures are made in the tummy, and through those punctures, gas is filled up in the tummy and a telescope is introduced into the tummy. The telescope is attached to a camera and the doctor can see what is inside. The other 2 or 3 ports which the doctor might create as the small incisions, which can be 5 mm incisions, are for operating instruments. So once your doctor or your surgeon has a look inside, they can identify the areas of endometriosis and those areas can be ablated. The cyst, if you have endometriotic cyst, can be removed through these keyholes. So the keyhole surgery is definitely a better method. Why a better method? One is that your recovery time is much less than a traditional surgery. So in a traditional surgery, the incision is much bigger. It might be an incision which is a vertical incision or a transverse incision, and the length of that incision would be somewhere between 6 to 10 centimeters. While in a keyhole surgery, the incision is very small. They are very small incisions, so they could be 5 mm incisions or 10 mm incisions which the doctor might create to do your surgery. So obviously, the incision is small, the recovery time is better. So if you're able to go home the next day post a surgery, definitely you will feel that you've recovered faster. And the downtime post the surgery of going back to work also reduces. So in a keyhole surgery or a minimal invasive surgery, the advantages are a smaller incision, shorter time of hospital stay, and back to work much earlier. Along with that, the chances of infection, bleeding, damage to the surrounding organs, the chances of forming a hernia at the incision site are all reduced with minimal invasive surgery. So, in the modern day gynecology or the modern day surgeries, laparoscopy is the answer for endometriosis. Traditional surgery these days is rarely used for endometriosis.